Thank you so much for being here for this virtual lunch and learn. If you don't know me already, my name is Autumn Giat. I'm the field director here at the Rhode Island AFL-CIO. And here with us today is Patrick Crowley, Secretary Treasurer for the AFL-CIO. He wears a lot of hats in labor, but right now he's going to talk to us a little bit about healthcare. So Pat, take it away.
Great. Thank you very much, Autumn, and thank you to you and Haley and everyone that's put all the time and effort into putting this series together. It's been very helpful and I think very informative for the members across the state. Before we begin, I think it's be appropriate, given the news of the day, that we just take a quick moment of silence to remember all of our siblings in the state of Maine who lost their lives to, once again, an act of senseless gun violence. All right, thank you. Let's just get right into this presentation and we'll take it away. So I wanted to start off with just saying, why does the labor movement really care about healthcare? I mean, what does it matter to us? Well, for really three reasons. Our members are consumers of healthcare, our members are deliverers of healthcare, and our members are providers of healthcare. So what does that mean? Well, the first bullet point should be pretty obvious. All of us engage in the healthcare system at some point in our lives, and most of us, on a regular basis. So we are consumers of the healthcare marketplace, just like all non-union people and just like everyone else within the state of Rhode Island. But also our members are deliverers of healthcare. Right now, there's about 76,000 people working in healthcare across the Ocean State. About 15,000 of those are union members. So when you think about it, about 20% of the healthcare workforce in the state of Rhode Island are union members in the state, which is pretty consistent about where we represent people throughout Rhode Island. The AFL-CIO has about 80,000 members in the state. That's just under 20% of the workforce are members of a labor union in Rhode Island. And in healthcare, those numbers pretty much match up as well. But the third bullet point, I think, it might not be as obvious to people, but our members are providers of healthcare. And what I mean by that is it's our labor movement and our unions through either a collectively bargained health insurance plan with an employer, or even more directly with a number of unions that have what's called Taft-Hartley health and welfare funds. The collectively bargained health insurance plan is a little bit more familiar to people. That's when a union negotiates a labor contract with their employer, and part of that contract is when the employer provides the worker and the union member health insurance directly. A Taft-Hartley plan, which is found a lot of times in the building trades, but also in certain industries where it's more short-term and part-time work. So there's about 20 different Taft-Hartley plans in the state of Rhode Island. And what those plans do is they're a labor management plan where the worker, as a portion of their pay, a certain dollar amount is contributed into this fund, and out of that fund, health insurance is provided. So when you think about everywhere that we touch the health insurance market and the healthcare market in Rhode Island, it's important for working people like us to have, one, an understanding of how this stuff works, and two, how we can be influential in this process. Now, as I go through the presentation today, I just want to make it clear that most of these sources are coming from publicly available information. So the Office of the Insurance Commissioner, OHIC in Rhode Island, the Governor's Workforce Board, and Health Source Rhode Island are just a few of the places where this data and information comes from. The people over in these offices do great work analyzing health insurance and healthcare in the state of Rhode Island, and have been working on a number of ideas to make the system work better. In addition to that, there's a number of different organizations that are exploring different options to make health insurance more affordable and healthcare better in the state. So, for example, there's an a committee chaired by the Office of the Insurance Commissioner called the Long-Term Cost Trend Steering Committee that is looking at how health insurance costs have changed over the last several years and decades. But also at the Rhode Island Foundation, they've created a study group called Health in Rhode Island, that is looking at the healthcare marketplace in totality. So everything from how prenatal care is delivered, to how end-of-life care is delivered, to everything in between. So there's a lot of people in the state looking at healthcare and how it works for everyday Rhode Islanders, because in many ways, and we'll go over this during the presentation, in many ways the healthcare system is on the brink of some serious concerns regarding its funding and where it's going to go in the state. And I know a number of political leaders have been looking at this, and I think this might be an opportunity for people like us, working people, to get an understanding of what the marketplace looks like so that we can take part in that conversation. So just a few numbers to get people kind of grounded in the conversation. There's 1 million Rhode Islanders. As of today, 350,000 people in the state get their health insurance through Medicaid. Now, Medicaid, if you don't know, that is the national public health insurer for poor people. So 350,000 Rhode Islanders get their health insurance through Medicaid. An additional 250,000 people get their health insurance through Medicare. Medicare is the national health insurance plan for the elderly and also for certain disabled young people. The next largest group of insured people in Rhode Island get their health insurance plan either directly or indirectly from a collectively bargained plan. Now, what does that mean? Like I said, there's 80,000 union members in the state of Rhode Island. Now, when we bargain health insurance, either directly with our employer or through our Taft-Hartley plan, many people in our dependents are also covered by that plan. But in addition to that, for a number of employers, especially some of the larger employers, in particular the state of Rhode Island, the health insurance plans that the unions negotiate for their members also apply to the non-union people in the workplace. So in the state of Rhode Island, for example, there are about 8,000 union members that are represented through the collective bargaining process for health insurance purposes. But when you add in all state employees, including supervisors, managers, non-union people, there's about 13,000 people that get their health insurance directly from the state as an employer. That means the 8,000 people are bargaining for the 13,000 people. That's why when we talk about how many people are covered by that state plan, we call it 33,000 lives. The vernacular way of talking about this is we cover 33,000 belly buttons. So when you apply that across the state to all of the large plans, the large employers, Lifespan, Care New England, Brown University, the real big employers, those that's why we get to 200 to 225,000 people that get their plan directly from a union negotiated plan. There's about 28,000 people that are enrolled in Obamacare in Rhode Island. That's the healthcare marketplace that was created by the Affordable Care Act, also known as Obamacare. And as of today, there's still 29,000 people who have no health insurance in the state of Rhode Island. That works out to be about 2.9% of our population. Now, luckily, that number is down tremendously since the advent of Obamacare about a decade and a half ago, where it used to be in the low teens, 10 to 15% of the population at any one time did not have health insurance. Luckily, it's down to 2.9. Theoretically, it should get to 0. And the more people we have insured, it actually is better for everyone in the state. Now, I want to start off with this slide here because I think it's important for folks to understand how big health insurance and healthcare is in Rhode Island. So in 2021, the last year we have available for numbers, $8.6 billion was the total healthcare spend in Rhode Island. So just to put that in perspective, our state gross domestic product, now that's all of the dollars that are spent in Rhode Island, is about $55 billion annually. So healthcare at $8.6 billion annually works out to be about 16% of the state's economy. It's the single largest economic block within Rhode Island. So all of the things that go into healthcare, the Medicaid and Medicare expenses, the commercial, the various features of it, all of the stuff that we spend our dollars on health insurance is a huge part of the Rhode Island economy. So huge, in fact, that if there's any catastrophes within the healthcare marketplace, it really does have the risk of dragging down the entire economy. So it's important for us when we think about health insurance that we think about it in those terms, that this is a crucial element of every part of our economic lives. And as you can imagine, with a health insurance pool that large, Rhode Island spends quite a bit of money on its people when it relates to health insurance. Right now, according to the last available numbers, which come from 2020, we spend as a state $13,663 per person per year for health insurance. That's the 13th highest in the state. And there's a lot of different reasons why that number is higher than in other places. We are an aging population for sure. We are a population that is closer to health insurance, so we have better access to direct care. But it's also related to a number of the ways that the health insurance marketplace works in this state. And just in terms of how to put this in perspective, that $13,000 per capita spending, that's 2.45 times higher than it was in the year 2020. Another way to look at it is this: per capita healthcare spending has increased by 240 times since in the last 20 years. That's just a remarkable rate of growth. On average, health insurance and healthcare grows by 4.6% per year, while gross domestic product, that $55 billion pool, only grows about 2.9%. And then when you think about how that relates to workers' wages, the average wage increase between 2000 and 2021, if you add all of that up together, wages have increased by 77% over the last 21 years. Now that's a little bit misleading, however, because that 77%, most of those wage increases accrue to the top 1% or the top 5% of wage earners. For average working Rhode Islanders, our wages have been stagnant, not since the year 2000, but really, if you look back even further, since the year 1979. While there's been some ups and downs, for the most part, wages have remained stagnant. But even if you want to look at it over the last 20 years and that 77% increase, the way to look at it is this: that's actually a 168% unfavorable differential, as economists would call it. In other words, it's a 186% wage cut to workers over the last 21 years, primarily due to the rising cost of health insurance. And if you look at this slide in particular, what that means is that at this time, for every dollar a worker earns, 17 cents out of that dollar goes to pay state and federal taxes. 31 cents goes to pay for health care, and 52 cents is what equals your take-home pay. So for every dollar raise we get, half of it goes right out of our pockets in taxes and healthcare. So if people feel as if they're not making progress and not getting ahead economically, healthcare and the cost of health insurance is a key component of why that's the case. Now, I think it's important for us to try to have an understanding of how health insurance and the cost of health insurance cost increasing directly impacts working people in their paychecks. So when you think about it, health insurance is paying for the services that we get from health insurance providers. So when those health insurance costs at the provider level increase, that means the insurance companies that are insuring us and our members have to spend more money on the claims because the cost of the claims are increasing. And as a result of that, what health insurance providers do is have to adjust the product that they are offering to us. So one of the ways that they do that is they increase the out-of-pocket costs for patients, for our members. A second way that they do that, excuse me, is that the covered benefits get reduced or narrowed. So there's less coverage in our insurance plans. They're less robust. The other way that this happens, that it affects healthcare costs, is that the employee's premium increases. So what we pay for health insurance through our paychecks increases on a dramatic way. Likewise, employers see an increase in what they're paying to insure their employees. Now, there's two direct results from that. Employee wages grow more slowly because health insurance costs eat up more available money for paying them, and firms' profits decrease. So at every step of this flowchart, at every point of inflection in the healthcare marketplace, when health insurance costs increase, it is a negative cascading effect throughout the entire economy as a result. And I think we're seeing that with how our members are looking at that. And just so you get a sense of especially how this impacts out-of-pocket expenses for working people. In the year 2022, in Rhode Island, the average out-of-pocket cost for healthcare was $2,569. That's an increase of 21% over 2020. Now, that's a huge amount of money for an average working person and the average working family to have to cough up for their health care on an annual basis. And the scary thing about this is that these are numbers that are reflective from our experience during the pandemic, which means that what researchers were looking at was a time when people were not actually going to the doctors or utilizing medical services as much as they were before the pandemic and as much as they have after the pandemic. But if you can see from this chart, from 2012 to 10 years later in 2022, that number has been steadily increasing except that blip year during the height of the pandemic in 2020. What we're afraid of and what we will likely see is that in subsequent years, 2023, 2024, that number of $2,500 annually is going to increase and probably increase dramatically. Now, there are direct consequences for working people as a result of this. The first is that, if you can see how many people have had problems paying their medical bills as a result of this steep rise in costs. So the first side of this chart on the left-hand side, you can see in 2012, 12.3% of our fellow Rhode Islanders had trouble paying for their health insurance of a bill over $500. That number has stayed very consistent, and so much so that, in fact, in 2022, the last time the numbers were available, still 12.3% of Rhode Islanders have trouble paying a bill that's over $500. Now, just to put that percentage in perspective, 12.3% means that 123,000 people in Rhode Island had trouble paying a bill over $500. And because most of us have an insurance plan that covers not just us, but our families, it really means that 123,000 families had trouble paying a bill over $500. And then in the second half of the slide, you can see problem paying any medical bill by the year. In 2012, which is really like the first beginning parts of Obamacare, 24% of Rhode Islanders had trouble paying even the smallest medical bill. Now, luckily, that number has decreased until 14.9% today. But still, that means 150,000 Rhode Islanders have trouble paying a medical bill over the course of any 12 months. That's a staggering percentage of our fellow Rhode Islanders that are just having so much trouble making ends meet. And when you see the consequences of what it means to have trouble paying those medical bills, it's pretty staggering. 3.5% of our fellow Rhode Islanders have been unable to pay for basic necessities like food, heat, or rent because their health insurance costs are so expensive. 5.2% of our neighbors have used up all or most of their savings to pay for healthcare. And then again, another 5.3% have had large credit card debt or have had to take out a loan against their homes just in order to pay for their health insurance care. Again, 5.3% doesn't sound like a lot. That's 53,000 people have had to go into usury style debt just to pay for healthcare. Yeah. And then when you look at the final column, when you look at the folks that have filed for medical bankruptcy as a result, even with the advent of Obamacare and even with the support systems that are in place through Medicaid and Medicare, 0.3%, that number of people needing to declare bankruptcy because of medical costs has remained fairly consistent over the years. Now, one of the reasons why health insurance costs have grown so dramatically over the last few decades is the cost of pharmaceuticals. The pharmaceutical market in this country and in the state is so broken that a small percentage of people that have, very rare but important pharmaceutical needs drive the costs up for every single other person in the state. And that gives me an opportunity to talk about two things. But first, I want to talk about the drug cost driving up. So for example, there's a drug that you might see advertised on a regular basis on TV called Humira. It's a immunological agent. In other words, it's a very strong anti-inflammatory type of drug. It's for people with rheumatoid arthritis, Crohn's disease, other types of diseases that not just regular inflammation that Tylenol or acetaminophen would cover. These are chronic, debilitating diseases that are very dangerous to people's health. So a drug like Humira, when it was introduced to the marketplace in 2021, every dose of Humira costs almost $7,000. And since then, the price has increased by 80%. Another drug, almost like Humira, another immunological agent, again, Crohn's disease, a lot of intestinal bowel diseases, IBS, rheumatoid arthritis. That drug called Stelara, when it first got introduced into the marketplace in 2017, the cost of that drug was $9,600 per dosage. By 2021, the cost of that drug per dose was $14,600. That's a 150% increase, excuse me, over the last 3 years. And then just rounding it out, you can see the drug Enbrel. All of these drugs you see advertised on TV on a regular basis. That cost has gone from $4,000 in 2017 to $5,800 in 2021. But then, as you can see, at the end, that cost per unit has dropped, but what they still increased the cost by 32% over the period of 4 or 5 years. So the rise in drug costs is really what's driving our health insurance cost increases. Now, you may be asking, why would someone else's pharmaceutical needs increase the costs for everyone else? Well, part of it is the way that health insurance works in this state and across the country, really. Most large employers, including most employers in the state of Rhode Island, offer what's called self-insured insurance. So self-insured insurance plans means that for every particular group, whether you are a worker at a small company or you're working for a large organization like the state of Rhode Island, everyone's costs are pooled together. So in 1 year, I may not go to the doctors other than my annual physical. So my cost in health insurance for me might have been $500 total in any particular year. But the person who's working right next to me may have a chronic condition that needs a very expensive immunological agent in order to keep them alive. She may be using $1 million of health insurance a year. In a self-insured pool, all of our insurance, all of our healthcare costs are pooled together, and our employers pay those costs directly. In other words, our insurance plan, Blue Cross Blue Shield, United, Tufts, Aetna, whoever it may be, all they're doing is taking the boss's money and getting it to the right healthcare provider. So even if only a small portion of Rhode Islanders or a small portion of our co-workers are unwell enough that they need these very expensive drugs, it impacts all of us. And just to help illustrate this point, why am I not moving down? Hold on. There we go. The average annual price increase for prescription drugs over a 5-year period increased by 26.3%. Over the same period of time, income only increased by 12.3%. Our wages can't keep up with the cost of health insurance. That's why one of the reasons why so many of our members feel like we're moving backwards. And when you think about the cost of health insurance, especially about pharmaceuticals, 21% of Rhode Islanders between the ages of 19 and 64 actually talk about not filling or not following their prescription because they can't afford to take their medication. Now, this is where things get really unfortunate about this, is that because when you don't take the medication that's prescribed to you because it's too expensive, you end up getting sicker. So by getting sicker, you cost the health insurance system more money to deal with whatever disease or sickness you're suffering through because it was too expensive to deal with the disease that you're suffering with. So it's this never-ending negative feedback loop where the cost of prescriptions is rising so fast that it's making people sicker. Because people get sicker, their health insurance costs increase dramatically. Their health insurance costs increase dramatically, they need to take more pharmaceuticals. And the cycle repeats itself over and over and over again. And until we can figure out what we can do about those things, it's going to continue to drive the health insurance plan higher and higher. Another reason why in Rhode Island that health insurance costs have escalated as much as they have is that because about 6 or 7 years ago, the state of Rhode Island froze Medicaid reimbursement rates. Now, what does that mean? The federal government is responsible for the Medicaid system in Rhode Island. And like I said at the beginning, 35,000 Rhode Islanders get their health insurance primarily through Medicaid. It's the largest single employer. So what Medicaid does and pays for services drives the whole economy question in Rhode Island as it relates to health insurance. But the way Medicaid works is the state picks up a portion of the cost for providing that Medicaid services to our residents. So if the state of Rhode Island pays less in Medicaid, that means the federal government pays less because it's a matching system. Whatever the federal government pays, the state pays. So if the state freezes Medicaid reimbursement, that means the federal government doesn't give us more money from Medicaid. But when you think about it, the cost of those services increases every year regardless of what Medicaid pays for. So because people on Medicaid are still getting this service from their medical providers, the medical providers are spreading their increased costs over the entire population, which means that our rates increase even though we're not on Medicaid, even though we're not directly impacted by the Medicaid or even the Medicare system. Another way to look at this is that it's a tax increase on working people. By the state of Rhode Island freezing Medicaid reimbursement rates, it means what you, me, and everyone else pays for health insurance has to go up. If the state increased Medicaid reimbursements on even keeping up with inflation, never mind keeping up with pharmaceutical inflation, it would mean that that cost would be spread out in an entire different way. The current system works against us because we end up picking up the slack. Now, a third feature of why health insurance costs are going up is because we simply don't have enough people working in the health insurance field today. Prior to the pandemic, health insurance in Rhode Island was a very, was a better than average place for a working person without a college degree to earn a good living. Whether you were a certified nursing assistant, you were a medical assistant, maybe you were a medical secretary or transport person in an office, maybe you worked in the dietary office, whatever the case may be, those were good working class jobs that people in all of our Rhode Island communities could get without a college degree and still earn enough money for a family sustaining wages. Since the pandemic, the money that's been in the health insurance marketplace has been so diminished that wages have not been able to keep up with worker demand. So a lot of workers are exiting the health insurance marketplace. Now, normally in functioning markets, when there are fewer workers doing the same job, that benefits the worker because the scarcity means that their labor is more valuable to their employers and they have to pay more money in order to keep those people working. I'm not a capitalist by any stretch of the imagination, but that's how capitalism works. If you need 10 of us and we're not willing to work for what you're paying, you as an employer are going to be, stuck. It actually works in reverse in healthcare because healthcare providers don't have the luxury of simply raising prices in order to cover labor cost needs, because all of their costs are either reimbursed by health insurance plans or by the federal or state governments. So they simply can't raise a price, because every time they raise a price, we go back to that feedback loop that we talked about earlier in the program, where you raise prices, you depress wages. You depress wages, it's harder to fill jobs. So if you look at this particular sheet that comes from the Governor's Workforce Board, the top line of that, nursing assistants, there's an annual opening of almost 1,300 certified nursing assistants across the state of Rhode Island on an annual basis. There are 1,200 openings every single year for home health aides and personal care aides. And the list goes on and on. We used to be able to replace all of those openings every year. Now we don't. And this is more pronounced in nursing than it is anywhere else. So in nursing, what we're seeing is that the state of Rhode Island produces, on average, 918 registered nurses every year from our colleges in the state of Rhode Island. We need to replace about 741 nurses every single year. So when you think about that, we should be ahead of the game, right? We create 918 new nurses every year. 741 nurses leave every year. We have a surplus of about 120. We should be golden, right? Doesn't work that way, because that 741 number of nurses who leave every year is fairly consistent. A large group of that is people that just, get to the end of their careers and retire. And then the next group of people is the group of people that simply decide at some point within their working lives that they don't want to do nursing as a career anymore. They want to do something else, or they want to do something completely different with their medical degree. That 918, though, as one of the notes here says, not all of those 918 people stay in Rhode Island. Some of them go to Massachusetts, Connecticut, or other places in the country where they're finding job opportunities. Another group of those 918 try to enter into the nursing field and just decide it's not for them for whatever reason. Maybe it's family reasons, maybe the job isn't what they expected. So when you actually look at the rate of return on how many nurses we lose per year versus how many new nurses we recruit every year, we lose more nurses than we gain. And that's going to continue to be a problem until we do a couple of things. First, we need to make sure that we create a much more attractive way for nurses, to get into the profession. And then we've got to figure out ways to keep them in those jobs. Now, the real question is, what can we do about all of this? This health insurance marketplace seems like it's a behemoth, right? It's an $8.6 billion market and a $55 billion GDP. How can we as 80,000 union members have any influence in how this process works? Well, the first one, and this is the one that we need to be a lot more articulate about, and all of us need to talk about much more, is that we need to increase union organizing as a way to raise wages and rebalance the shifting of healthcare costs onto the backs of working people. Because I think most of us on this call can appreciate, as much as it's been hard on our union members to pay a bigger percentage every year for our health insurance costs, just imagine working in a non-union employer where instead of paying 20 or 25% of the cost of a health insurance premium, you're paying 30, 40, or 50% of that cost. So we do have an advantage as union members to be able to negotiate less of a burden on ourselves and our members that non-union workers don't have. So if we really want to attack the rising cost of health insurance for working people, we've got to increase union organizing, both as a way to raise wages, but to keep health insurance costs from falling onto our shoulders. The second way that we need to do that is we need to continue to keep raising the minimum wage in this state. Many of those people that we talked about earlier in the slide presentation that had difficulty paying medical debt over the last couple of years, many, if not most of those people are at the bottom of the economic ladder. They're making minimum wage or just above minimum wage. So as the minimum wage stagnates or doesn't keep up with inflation, that means that those people at the bottom of the rungs of the ladder are going to see the differential between what they earn and what it costs to keep themselves and their families healthy. That's going to continue to expand. And at some point, that's just going to reach a breaking point where it's going to cost more to insure your family than you're making in your wages on an everyday basis. So we need to continue to keep raising the minimum wage so that we don't continue in this downward spiral on health insurance costs. The next thing we may want to consider is that the state of Rhode Island should probably look at reconstituting a body that was created back in the middle part of the 2000s called the Rhode Island Healthcare Coordinating Council. A law was passed back in 2006 called the Rhode Island Coordinated Healthcare Planning Act that created this commission of healthcare experts, users, providers, doctors, nurses, etc., to look at how Rhode Island developed its health insurance plan. And since about 2008, this committee has not done any work because the state of Rhode Island stopped funding it. So there's been some efforts within the healthcare community to reinvigorate the Healthcare Coordinating Planning Council so that as a state, we can start to set more proactive direction on how we tackle health insurance costs. The other thing that we need to do, both connected to the Coordinated Healthcare Planning Act, but also separately, is we need to find a way to increase reimbursement rates for Medicaid in the state of Rhode Island. The fact that it has been stagnated for now going on 6 or 7 years is holding us back as a state and as an economy, but especially as working people. Because the fewer dollars the state puts into Medicaid, the more dollars come out of our pocket to make up the difference. And that's a regressive tax. It's actually costing people that make less money more to subsidize the system because the state is not putting in their fair share into the process. Now, luckily, Senator Lou DePalma and Representative Julie Casimiro in the General Assembly have started the process of looking at how the state can adjust those reimbursement rates. It can't happen fast enough from a working person's point of view, because we need to make sure that there's a fairer system in place, and we need to start thinking about this as a backdoor tax increase on working people, because that's exactly what it is. Thirdly, we need to start looking at legislation that is going to restrict the cost of pharmaceuticals. It is unconscionable that even though typical health insurance costs rise around the same level as Social Security-based inflation every year, 2.5% to 3.5%, depending on the overall nature of the economy, to let a few drug companies run roughshod over our entire economy by jacking up the costs of these drugs that are definitely needed by the patients that are subscribed to them, but are generating billions and billions of dollars in profits for these health insurance companies. They're profiting off the fact that people are sick and need these drugs in order to survive, but they're also profiting on the fact of our health insurance costs rising dramatically and our wages not keeping up the pace. That's making Big Pharma rich while it's making our members poor. So we need to figure out a way to restrict the cost on an annual basis of drugs, something that the federal government is just starting to do thanks to President Biden and the Inflation Reduction Act that gave the federal government for the first time to negotiate directly with with pharmaceutical providers on a list of 10 drugs, so that Medicaid costs can be driven down as a result. You won't be surprised to learn that many of the same drugs that I mentioned earlier are on President Biden's negotiating list to try to drive down those costs. The last thing, just to put out there for folks to consider about what it is that we can do as a labor movement in order to attack this problem, is that we need to have a worker-centered focus on workforce development in the state. We need to have a working person's approach to making sure that we recruit enough people to work in healthcare, whether it's as a CNA, a medical secretary, a dietary assistant, or an LPN, or a registered nurse, or even a medical doctor. And one of the things that we have been working on as a labor movement, that we will have more news about later on in the fall, maybe by the time you're watching this on, is that we've been working with our partners on the management side of the table within the healthcare industry to create a labor management nonprofit that is designed specifically to recruit and train and retain. And we've got to make sure that these jobs, especially these union jobs, continue to make forward progress on an economic basis.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments.